Hello, everyone, and welcome to Preventative Health Awareness Month on this Happy Hormones Day. Boy, oh boy, are we ever excited to be sharing all kinds of education through the ages and stages of life when it comes to our hormones and the impact it can have on our overall health. I got to tell you firsthand that I've experienced the impact that hormones can have as I went through menopause at a very young age, at the age of 39. And today, I have the absolute privilege and pleasure of introducing you to a professional that I have a great deal of respect for, that has become my friend and who has had the impact on thousands and thousands of women when it comes to empowering them when it comes to their hormonal health. Dr. Kristy Prouse is a gynecologist and obstetrician. She's trained in functional medicine. She is the chief medical officer of the Institute for Hormonal Health, where I first met her as a patient. And she's far greater than that. She is a wealth of knowledge. She is a patient empowerment advocate. And I know she's a supporter of preventative health. So Dr. Prouse, thank you. I know how busy you are. Thank you for taking the time to come, and welcome.
Oh, thank you so much. I'm excited to be here and to always work with you. It's always such a pleasure.
Well, thank you so much. So let's harken back to the day that I walked into your office at the Institute for Hormonal Health, really struggling, needing help, not knowing where to turn. And, I want to be candid about my story in that I have a lot of tools in my toolbox. I have a lot of people and connections. And yet I still felt lost in the wilderness and not getting help, necessarily the help that I felt I needed and wanted because of the way I was feeling with the team that I had. And that led me to your office. And I was intrigued by your bio because it's impressive, being an obstetrician and gynecologist and then into functional medicine. So before we talk a little bit about my story and the state that you found me in, how do you go from being a gynecologist obstetrician to functional medicine, focusing on functional medicine and now really delving into hormonal health?
Yeah. Well, it was, really going hard from work perspective. Every gynecologist obstetrician does, right? And certainly delivering babies at ungodly hours. And, by the time I had, reached that end of my career, I had delivered just short of 10,000 babies. So it's a lot. It's busy, a lot of responsibility and whatnot. And it really, between that and raising, twins at home, there was just a lot on my plate. And it really started to catch up with me, but I didn't recognize that it was catching up with me because I think there's this tendency to normalize stress, right?
Yes.
Saying things like, well, of course I'm tired. I've been up all night, right? Or
Right.
I've always done it that way. So, I just failed to recognize that the fatigue, the foggy thinking, and the irritability was something physiologic, right? And
Yes.
stress has its impact. And so I really was not feeling great, and I turned to my conventional knowledge and could not figure out what was going on with myself. It just got to that point where, hey, wait a second, I can no longer ignore this. And really, I kind of laugh about it now, but out of desperation, I connected with a naturopath and a traditional Chinese medicine doctor all in the same morning. That's what type A
Of course.
personality do.
Yeah.
And they both came to the same conclusion, different ways. And so it caught my attention. Like, how could two professionals come to the same conclusion, and yet this is a conclusion that I don't know what that is. It was adrenal fatigue. Now, I'm not a big fan of the terminology adrenal fatigue. It's a bit of a misnomer, but nevertheless, it is something that is real and is out there. And although I call it something differently, cortisol dysregulation, it's what I was struggling with. And for me, when I hear cortisol, the hormone, I think of the extremes of disease. So Addison's and Cushing's. Well, I knew I didn't have Addison's or Cushing's disease, but I've got two professionals that are saying the very same thing. So I better start looking into this if I have any hope of feeling better. And sure enough, I, worked through the whole process, mind, body, spirit, had lots of shifts and lots of changes, really to start feeling better and to appreciate I am not going to be the only one that's struggling with this.
Yeah.
And that was the motivation to leave the conventional medical model and study in a different way, paradigm shift, and how do I look at medicine and healing, and that's where the Institute for Hormonal Health was born now 12 years ago. And from there, locations have expanded to downtown Toronto, and Vaughan will be coming soon in the new year. So it's, it's been quite the ride. And, but that's how a gynecologist
Yeah.
leads the conventional model and does things differently. Yeah. Physician
Yeah.
myself, right?
Yeah. And that's all, it's just so neat to hear your story because, how human of you to be experiencing that as a woman. And I know there are going to be women watching this and professionals. They may not be a doctor or maybe they are, but they're up late at night with children and they're struggling. And there's, only in the last couple of years has there been this huge surgence of conversation online about, hormones and menopause and perimenopause and all the things, because there really wasn't that. And that's what brought me to your office almost 10 years ago now,
Right.
as a patient, because I was desperate, fed up, sick and tired of being sick and tired and not getting the answers from my, conventional medicine colleagues that I was wanting something different. And I knew there had to be something more. But I kept pushing through, and I'll never forget your face when you got all of my results back and you've got this sort of smile, not a smile, but this knowing on your face. And you said, Marg, like you must be feeling like you're pushing through cement. Those were the words you used.
Mm-hmm.
And that was exactly what I felt on so many levels, mentally and physically and emotionally and sexually. And oh my goodness, it was challenging. And I was younger to be going through menopause because of my pre-existing condition of severe endometriosis and all the things I'd been through. And I got to tell you, it felt not only like a safety net, but Dr. Prouse, I felt heard in your office.
Mm-hmm.
And that sort of led us not only to embark on helping me with my own health, but it also led us to almost 10 years ago now, you and I together with other professionals produced a 3-part hormonal health series. And we're going to tell everybody about that here right now, because you should go to YouTube to the Become the CEO of Your Health channel and check it out, because thousands of people have seen it. So let's get back to when you saw my results. And I'm sure I'm not unlike, obviously there's differences from patient to patient, but there are some commonalities as we approach perimenopause and menopause, but also when we talk about this cortisol dysregulation.
Mm-hmm.
Cortisol is a hormone that can have tremendous impact on our overall health. Can you speak to cortisol, what it is and why we should care, and how that plays in to the health and the way women are experiencing, their overall health?
Yeah. So cortisol is our stress hormone, and it's meant to help us manage with our stress. The problem is that the system can be on overload for continued stressors, whether it be physical stressors, emotional stressors, right? When we think of stress, we typically think of the emotional and psychological stressors, but there are physical stressors to the body. And so, when we're exposed, we call on cortisol to combat it. So really, when the system's on overload and it can't keep up, there's a very predictable pattern of symptoms that follow. So fatigue being one of the most common things, but there's also a pattern to that fatigue. Usually we're a little bit slow to wake up in the morning, but once we get going, we're okay until we've got that afternoon dip around 4 o'clock. You perk up again and you get to about 7:30, 8 o'clock. You're falling asleep on the couch, but that's too early to go to bed. So you're sort of push your way through that. And then of course you get your second wind. So then you're up too late. Yes, you go to bed and then you're waking up again between 2 and 4 a.m. in the morning, right? So
check.
Yeah, exactly.
Check. Almost like a tired but wired feeling.
Right.
Like I'm desperate to go to sleep, but I'm on overdrive and I'm wired and I couldn't sleep.
Exactly. Yeah. And that's actually very classic for an elevated cortisol, but we can also have low cortisol as well. Both of them feel lousy, right? So fatigue is one of the bigger players for sure. But then through that, because it's a foundational hormone, it drags in other systems and other hormones. So you start seeing a pattern with, gastrointestinal issues, maldigestion, malabsorption, right? A leaky gut that leads to food sensitivities. And there's a big connection between gut and brain neurotransmitters, right? So cortisol dysregulation often goes along with anxiety, depression, but certainly in the earlier phases, irritability, right? So everybody's an idiot.
Yep. It was everybody else's problem in this house.
That's right.
Not mine.
And that's classically a cortisol issue. The sleep disruption is another very common thing, and that's tied into the brain neurotransmitters as well. Basically, immune system can get dragged into it. So people that have cortisol dysregulation, they often find that they're getting sick more readily, taking longer to feel better afterward. Wounds heal a little bit more slowly. And then there's the impact on the sex hormones as well, right? And so, sometimes the cortisol dysregulation can go on to create a problem with sex hormone imbalances, but most certainly it can aggravate any pre-existing sex hormone imbalances. So things like endometriosis is certainly one of them. PMS can be exaggerated, heavy periods, painful periods, those sorts of things. So there's a big connection between cortisol and sex hormones. And then, of course, when we get into menopause too, if anybody's wanting to know how to transition nicely through to menopause, it's by getting the cortisol piece of it in check.
Yes.
And, that's really important. And one of the reasons why that is that when our ovaries start to decline, some of the production of sex hormones starts to switch over to the adrenal glands, which are responsible largely for cortisol production, but also estrogen, progesterone, and testosterone. So in that transition over to, putting the responsibility of the adrenal glands to produce these hormones, if they're already taxed because of the stress piece of it, then that transition doesn't happen quite as nicely. And it's not uncommon for me to see women whose estrogen and progesterone has dropped below the typical postmenopausal range.
Wow. Yeah.
So it doesn't matter, really, it just impacts on so many systems and aggravates also any pre-existing conditions that if you don't get at cortisol, then you're going to be chasing your tail with absolutely every other hormonal condition. And so that's really why I put so much emphasis on it. It's because it's what makes people feel better, but corrects other issues. And then there's the whole preventative piece, right?
Yes.
So cortisol left unchecked, eventually you get into, the possibility of high blood pressure, diabetes, cancers, those sorts of things. So it's not just about, wanting to feel better. It's about protecting yourself from down the road. And that's the number one hormone. If you want to address that, you got to get that one in check.
And you know what, Dr. Prouse, what amazes me in our culture, and I think we've had many conversations about this, we almost wear stress like a badge of honor, like I'm so stressed, or I haven't taken a holiday in 3 years. And, when you look at other parts of the world where it shuts down for 6 weeks because people go on holidays in Europe, and in a North American society where it's 24/7 and where we now have devices that we're constantly on overdrive, and there's just so many inputs, and we sort of wear this like a badge of honor, this stress, and insidiously over time, and this is where you and I, as professionals really connect and collaborate. I see this as a massage therapist on my tables, the fallout of it in so many different ways, and people not taking the time to listen to their body, and in that opportunity gap before they have that diagnosis, there are a lot of whispers that our bodies are telling us. I remember saying to you, I'd never been a really anxious kind of person.
Mm-hmm.
And I remember telling you that I had this feeling of a vibration in my chest.
Yes.
And you kind of smiled in a knowingly way. And you said, Margaret, that's anxiety. Mm-hmm. And I was like, what? I'm not anxious. What do you mean I'm anxious? Because I never seen myself as an anxious person.
Yeah.
Having that, like connecting that was a hard pill to swallow, because when you're a doer, you just got to do. But I knew that it was, and as the therapist in me, how silly of me to not connect the physical manifestation of emotional pain. And I was feeling it physiologically in my body in a way that some people can't describe anxiety. And it was so interesting yesterday.
Yeah.
I'm going to say this only because I was treating a 6-year-old who I've had the privilege of treating since she was a baby. She had open heart surgery, and she has trouble regulating her emotions, according to her mom. Mm-hmm. And so while I was treating her, because she's 6 and has had massage therapy with me since a baby, she's very in tune with her body now, which is really cool to watch. Mm-hmm. That's part of the preventative piece. Yeah. But I said to this beautiful little girl, when she, I said, oh, how does that feel? She goes, well, I had trouble with my emotions at school today. And I said, oh, you did? And she goes, I feel it right here in my brain. And I said, I looked at the mom and I said, bravo that you're bringing your child, that this 6-year-old is recognizing this, because I have 66-year-olds on my table that don't make that connection. Yeah. And immediately through massage, and what I instantly did was start to do tapping with her. And kids are incredible at tapping. And that's another whole topic. We're doing a whole thing on tapping during preventative health. There's 300, clinical studies, and it's right at your fingertips. And this child started tapping, and you could see immediately her stress levels coming down, her cortisol changing in front of my eyes.
Right.
How cool is that, right? And so I'm bringing it back to my story because I felt this vibration, but I looked at you and I said, well, what is this?
Yeah, well, and exactly, and you're definitely not alone in this, because there are sort of a classic personality that is set up to have cortisol dysregulation, and it is the overachieving, nose to the grindstone, multitasker, right? And those are the bright people that can push with this.
Yes.
And there can be a disconnect from the physical body. And I absolutely struggled with that myself, right? Just yeah, as you say, it's kind of numb or disconnected, and until things really go haywire, and I can't ignore
Deny it.
Yeah. So I think you're absolutely right. And another sort of personality, which, by the way, personalities are not fixed. What I'm about to say, the brain is very plastic, and we can make changes, and there's some great resources to do that. But the worrier, and the perfectionist, those are people that are classically set up for cortisol dysregulation. And it's important to know, the perfectionist, I think, when you frame it in such that a perfectionist is never going to be perfect, right? That, of course, and then you're going to beat yourself up. Well, that, I think everybody can understand that stressors, but the worrier is a little bit different. And I think it is important to understand that our body does not, it's not just about the moment where stress is happening. If we are, worrying about it happening in the future, or we're reflecting on it happening in the past, to the body, stress is stress is stress. Right. And so it, in that ways, the worrier really can get nailed.
Right. It's insidious, isn't it? And then over time, all of a sudden, that's what this whole Preventative Health Awareness Month is about, is bringing the awareness and recognizing that what we're doing now or not doing now is going to have an impact on us even 10 years from now. And therefore, if the more we understand and get knowledge and have tips and strategies in place, the more we can live well until we don't anymore. Because certainly there are studies that are saying the last, people are living longer, but those last 10 years of their life are not living well. It's awful. And we want to change that conversation. So when we talk about the fallout of cortisol, can you sort of frame for women, you talked about some of the symptoms, but now, like, what do we do? Because it's really scary when you're going through this. And where do you start? And let's talk a little bit about cortisol, and then the fallout, and then what do we do? What next?
Yeah. Well, I think if we stop and self-reflect and really tune into what our bodies are saying to us, it may very well be easy enough for you to identify some early phases and stages, right? So we talked about the fatigue and the mood piece of it, and all that. And I think, it can be simple enough, if it's caught early enough, to correct course with self-care and making some of the good changes that we know that we need to do, whether that be the dietary modifications, just eating well for one, sleeping well is another. But there's even bigger things that often have to come into play. And if you can figure this out sooner rather than later, or in your 6-year-old, right, is really starting to ask yourself some of the tougher questions, but we don't even think to even ask ourselves, like, why do I show up the way that I show up? Why am I a perfectionist or an overachiever, or why do I go 150 miles an hour? And the reality is that oftentimes we've just never questioned it. We get that messaging, right? It's culturally, from our families. It's a construct that we've never questioned. Because we see everybody else doing it, there's even less reason to question. And so I think it is important that, yes, you can catch this early, and there is a lot that you can do on your own and should do on your own, but there can also be a progression to a point where you can do all the things you're supposed to be doing, and not be making the impact that you're looking for, right? And so, it's good to know that cortisol and its metabolites, for that matter, the breakdown products, it's measurable, and you can look at 4 points over the day to see whether your pattern of release of cortisol is in a rhythmic fashion that it should be, or whether there's dysregulation there. And then depending on that degree of dysregulation dictates how one should be managed. But there's always the mind aspect of it, right? So that's where asking the tough questions in and comes into play. There's the physical body part of it. So filling somebody's leaky bucket, you can't fill it, the physical body, without plugging the holes in your leaky bucket, which is usually the emotional and psychological stuff that is draining the system. When you go to fill that physical bucket, it's actually usually pretty simple stuff, targeting some of the micronutrients that have become depleted. So classically with stress, we deplete vitamin C, magnesium, B vitamins. We can use herbal remedies to soften things while we're trying to set the foundation. And then you can get fancier than that if need be, right? So intravenous vitamin and nutrient therapy is, one such way. Vagal nerve stimulation, right?
Yes.
It depends. It depends on what somebody's story is and, how they're presenting, because we all seem to, although there's a predictable pattern of fallout, we all seem to have weak links in the system, right? So for some people, it might be the thyroid that takes a hit. For others, it might be the gastrointestinal tract. For others, it might be the sex hormones. Or others, it might be the mood. So, there is a pattern, and usually you see little bits of a lot of things. But that's where the individual treatment comes into play. It's important to identify where people are at and focus on not only getting them feeling better, but then once they're feeling better, it's about the prevention, right?
Absolutely. You mentioned about the cortisol, the typical cortisol curve. Can you just very briefly speak to what it should look like? Because especially in the culture that we live in, the society and the way that we've gotten used to living, and the perhaps vices that we're using to jack up cortisol artificially, which we don't even realize we're doing. Can you speak to what the curve should look like and how that fits into why we can't just fall off into a slumber, or why we're waking up like clockwork at 3 a.m. and not needing to go to the bathroom? I think people really need to understand, because I find the more empowered people are, that hence why we're doing this whole preventative health month. The more empowered you are, the more informed you are, your better health esteem to make informed decisions and ask questions of your healthcare team. But when you're just feeling lost because you don't understand the underlying, it's so important. So tell us about what a typical cortisol curve looks like throughout the day.
Yeah, exactly. So first of all, it should be at its lowest overnight, right? So if it's our stress hormone, we should be asleep. It should be low. Isn't always for everybody. But cortisol is part of what wakes us up in the morning. So you see in the morning that we increase cortisol really to its peak in the morning time. And then there's a gradual decline throughout the rest of the day. And by bedtime, it should be, again, hitting its low point and staying low overnight. Any hormone wants to be in the middle, right? So whether it's cortisol or melatonin or vitamin D or, estrogen, progesterone, doesn't matter. The hormone will want to be in its middle. But with cortisol, it doesn't matter whether it's gone too high or too low. It causes oftentimes the same symptoms. A lot of hormones will do that. And so, your pattern is helpful in understanding at what point in time of day do we need to target? Do we need to bring it down? Do we need to boost it? And, is it causing sleep disruption overnight? Well, there's all sorts of, tricks and tools that we can use. So there is definitely an advantage to measuring the different times of day to help, dictate treatments and getting somebody better.
And I found it was a visual representation of what was going on inside my body that I couldn't get a handle on. It was a real eye opener, literally, because I'm looking at my own cortisol curve going, oh.
Yeah.
And it was a bit validating too. No wonder I'm feeling this way.
Exactly.
And then the next step is now what, right? From the hormones to the meditation to the seeing the holistic nutritionist to the naturopath. I mean, I had my holistic team. That's what this is all about. But when you can't see it, sometimes we just can ignore it.
Absolutely. And the type of functional testing that we do, you can't unsee something, right?
It's true.
In the way that it's represented, it's a little different than the typical sort of traditional, here's the normal range and here's your number. It's graphed out for you, and it's pretty easy to go, oh yeah, I'm supposed to be between those two lines. I'm flatlining.
I'm so not. Yeah. Yeah,
Yeah.
exactly.
No, it can be very
Exactly.
powerful and motivating for that matter too. And as you say too, when you um, can connect how you're feeling and you can see it on paper, it is for most people, it's a relief. And it's actually an okay relief because we're not, generally speaking, talking about anything serious at this moment in time, right? So there
Right.
is something that can be done to undo it with effort for sure. But
Yeah.
that's where, the effort creates new habits, causes permanent change, right?
Absolutely. Absolutely. And when we're talking about new habits, you mentioned things like, nutrition and really looking at, the amount of sugars you're having and the whole foods. And this can be a challenge in the society we live in and the drive-through society and the frappe, latte, sugary, whatever drinks that people drink on a daily basis. Like there's a lot of what we do in our day-to-day life that we don't even realize is having an impact on our hormones, on the way we're physically feeling and the way we're able to function, but especially in the way we're going to function 10 years from now. And that's why this whole preventative piece is so critically important. Instead of literally waiting until something's broken or you get that diagnosis, what
Right.
can we be doing beforehand? So that leads me, speaking of what can we do literally before something breaks.
Right.
When we talk about cortisol, once again, stress, we all have it. It's part of life.
Mhm.
There's good and bad stress. But people don't realize that stress is insidious in so many things. And myself as a massage therapist and passionate about musculoskeletal health, and recently bringing, in collaboration with my colleague Megan at OsteoSound, bringing a new bone scan technology to Canada from Italy that's looking at not just bone mineral density, which I'd love for you to speak to because it peaks at around the age of 30 and we all lose that as we age,
Mhm.
but rather bone quality. And
Yeah.
you can have less bone, but you can have good, strong bone, which is often tied to lifestyle choices. And the latest research is saying that it's actually bone quality, not bone mineral density, that's a better predictor of whether you'll fracture due to osteoporosis. And stress plays a massive role in
Yeah.
osteoporosis prevention, osteoporosis treatment, and
Mhm.
just musculoskeletal health, even things like sarcopenia, losing muscle as we age. Can you speak to that whole thing from your lens as
Yeah.
women?
Yeah.
Because hormones play a role in
They do.
certainly in bone
For
health and
sure.
musculoskeletal health as we go into perimenopause and menopause.
Yeah. So cortisol is what we call a catabolic hormone. It tears us down. Brain cells, bone cells, skin cells, muscle cells, you name it, right? So it's really a tear down hormone. And estrogen and testosterone in particular are anabolic hormones. So they build us up, right? So at a time in our lives when estrogen, progesterone, testosterone, are potentially dropping, and we're getting nailed with the cortisol that's tearing us down. So there's a net deficit oftentimes. And so again, it can, one more thing, one more system that can be aggravated by having that cortisol
Yeah.
dysregulation. Mm-hmm.
And people don't see that. They think their bones, because bone health is often silent. And because of the way our system is set up currently, unless you're high risk, meaning, your mother had osteoporosis, maybe you don't even know that, or maybe you had an eating disorder and a doctor is wise enough to say, you know what, you maybe should have a bone scan, a DEXA scan, an OHIP covered bone scan. We don't we can't get a bone scan in Canada till you're 65. You don't qualify. But we know peak bone mass happens at 30.
Yeah.
And we've got all those years in between that things could be happening with our bones and it's silent.
Right.
And so stress being a big role in that.
Right.
Well, this new bone scan for 21 and older, if you get a baseline, or after you've had a baby, once you've had some hormonal changes after a baby, or you're entering into perimenopause to get that baseline, once again, coming back to that whole stress piece where we
Mm-hmm.
sort of slough it off and we don't realize that it literally can have an impact on whether you're going to break bones or not,
Yeah.
whether you're going to have muscle mass. And that's a predictor of longevity. There's a big study
Absolutely.
done, right?
Yeah.
Big study done. And I think it was 2014 where they looked at muscle mass and we're going to do this during Preventative Health Awareness Month, a little test you can do by standing and sitting. It becomes hard to stand and sit as we age when we lose muscle, lean muscle. And that is linked also to cortisol and poor nutrition, not enough protein. It's all intertwined. And you must see this in your practice all the time where women just don't realize
Yeah.
the fallout it has.
Yeah, precisely. And just so important that we explore each of those angles as well, right? As part of, as you say, like the baseline testing. Is there an issue? Is there not an issue? Is it in progress? Because a lot of these things that we can halt, but more importantly, if we could prevent them in the first place, right?
Right.
And I think it's so important. I know you and I are on the same page with this, is patients taking their own health care into their hands. And that doesn't
Yes.
necessarily mean that, you're not seeking, expertise from those that are experts. But so much of what we can do on our own, right?
Right.
And really,
Right.
I love encouraging patients to own their health and take
I
charge of it.
love hearing that. Thank you. And we need more physicians with that mindset. I mean, we've got a strained system. I think a
Yeah.
lot of it's because we've taught patients to be passive,
Mhm.
and just, go to the doctor when something's broken and fix the doc.
Reactive.
And we expect a quick fix. You said earlier, it takes effort, but
Mhm.
the reward is so much better, not just in the way you feel, but your quality and your longevity of life and your ability to really live the life you want to lead. But you have to take ownership for that. And that's why, we agree on this topic. You'll never hear me use the word alternative medicine, because I don't believe you should see your medical doctor or see your naturopath or massage therapist. I believe that we as Canadians ourselves are our most important member of our healthcare team, but
Mhm.
it's incumbent upon us to get all members of our team together. And that's what Preventative Health Awareness Month is about stocking your toolbox, so that when you go see your gynecologist or your family doctor or your naturopath, you're more informed, you have more confidence to advocate for yourself. But you have to take some ownership for the role you're playing in that, and that takes effort
Yeah,
and
for sure. For sure.
focus, right?
And
Yeah.
I would say that 100%. With the type of care that we're providing, we as the team, whether in my practice it's the medical doctor, the naturopath, right, the holistic nutritionist, you name it. If patients don't follow through with our recommendations, like, that's what makes us look good. If you can do what we're asking you to do and you're getting better and you're feeling better, that's awesome. That's what makes the difference. You have to participate.
And I love that. And that's what I'm hoping we're going to have more. I don't know if you can see the sign behind me, Better Together. And that's truly what I believe, that we all are part of this integrative health puzzle, and we all play a role in it. And that's what this is all about. So I just can't thank you enough for coming on and doing this. And I know you're going to be doing something more with us this month on health and tech, because you've always got your pulse. And this is what I love about you, because we're very similar this way, on what's the latest and greatest evidence informed technology, what's the future of
Right.
medicine, right?
Absolutely.
Like, let's just give a little sneak peek on that. We don't want to dive too much because we're just talking about hormones. Mind you, there's tech related to hormones. We talked about the vagus nerve and something we both love, the microcurrent point stimulation therapy device, otherwise known as the Dolphin. It's a
Right.
game changer.
Yeah.
And it can be put in the hands of everyday people, covered by most extended health insurance, so you can be using it at home. If my 80-year-old mother can use hers on a daily basis, you can too. And a lot
Right.
of insurance companies cover that. But let's just briefly talk about, you're going to be coming back and talking about health and tech, and the whole idea of epigenetics and bioenergetic medicine and all of the things that are pushing the envelope,
Mhm.
but that the science is there. Let's just
Absolutely.
give a bit of a teaser.
Yeah. There's so many different ways to go with this, but I think it's important to understand that we're living in a day and age that no generation has lived before. And, we are being, for example, exposed to light that is, not beneficial to us, at the same time that we are being removed from the light that is, right? So, we're sitting in our houses, we're sitting in our cars, we're not getting the full spectrum UV, and we're exposing ourselves. So again, the net of that is malillumination. And I could repeat all that I just said when it comes to electromagnetic frequencies, right? We have removed ourselves from the Earth's healing properties, and yet there are ways that we can return them. So it is absolutely fascinating, some of the technology that gets out there when you start thinking of, quantum physics and quantum entanglement, and which makes a lot of people kind of nervous that those sound like it's not. It's fun, it's cool, it's real, and can have such impact. And I really do believe that we are on the verge of making really significant progress in health and wellness. And but right now the technology is there. It requires the individual to get out there and start researching, whether it be light therapy, pulse electromagnetic therapy, right? Just so many different ways. It's about clean air, it's about clean water, it's about clean energy. And we're living in a day and age where we're not necessarily, getting exposure to all that we need, and exposure to stuff that we don't need.
Absolutely. Exactly. And clean food, you couldn't have said it better. There's so much potential there, but it's here already at our fingertips. And that's why during FAM, we're going to have a health and tech day. So make sure you're checking the global calendar at wellnessforwellness.com. Go to the FAM page and look at the global calendar for the health and tech day. I should know it off the top of my head, but there are 29 days in February this year. And there's a lot of education being shared over the course of the month, but that's coming. And of course, if you've got questions, and you've seen this interview I've done here with Dr. Prouse, reach out to us, ask questions. You can check out our blog, because we're going to be adding, not just in February, but all year long, because Preventative Health Awareness Month turns into Preventative Health Awareness Movement. This is not just about a 1 month thing. It's about a lifestyle and a change in the legacy of healthcare, one person at a time, doing this together. So thank you, Dr. Prouse, for coming on, and I really, really appreciate your time and your knowledge. And I look forward to having you back when we talk about health and tech and probably other things as we move forward.
And thank you, Marg. I mean, this is so needed, and I'm not surprised whatsoever that you're leading the march.
Well,
so, go.
Well, I'm not doing it alone, and I couldn't be doing this. I mean, this is a grassroots, non-funded right now. We'll eventually get funding. But when there's a will, there's a way. And, when you're passionate about something, even if we impact one person during the month of February, and that impacts the rest of their family, and so on and so on, then we've done our job. But I'm not doing this alone. I've got some incredible people behind the scenes, and it's growing. To have hospitals reaching out and cancer centers reaching out. And I'm sitting down at the end of the month with, an MPP and health critic. And it's very exciting to see that we're doing this together. And you're part of that. You're part of that, and a very important part of that. So on behalf of everybody, thank you, Dr. Prouse. Happy hormones. Happy Hormone Day. And if you are watching this on after February 15th, then you'll miss the actual live event. But if it's before, from 6 to 9 on February the 15th at the Himalayan Salt Cave in Georgetown, we are having a Happy Hormones playground where a bunch of different professionals, health professionals, are coming together. Bring your daughters, bring your mothers, and everybody in between to come and do a hands-on museum and learn and stock your health handbag, your hormonal health handbag, so you feel more empowered to ask the questions and become the CEO of your health. So I'm going to leave everybody with this thought, and please really think about it. A healthy tomorrow begins with prevention today. What are you doing today to help your tomorrow? Your family deserves it. You deserve it. And collectively as a world, we deserve it. It's time to change the mindset and really look at working better together in a preventative lens. So thank you, everybody. Stay safe, and we'll talk to you soon. Bye for now.